Today, we're looking at signs versus symptoms. We all have gotten sick at some point in our lives. Having visited the doctor to make a diagnosis, the doctor will take in consideration signs and symptoms in order to determine what the issue is. Here we have two pictures depicting sign and symptom. Can you tell the difference between that which represents sign versus the one which represents symptom? Great. Now let us look at a definition for sign. Simply put, sign are objective. They are not influenced by the individual's thought nor the individual's feelings. Signs can be detected by persons other than the individual experiencing the sign. It means, therefore, that the doctor could look at you or probably use an instrument like a thermometer to determine what's wrong. And when this happens, we say that he's checking the signs. However, there's also symptoms. And symptoms, we say that they are subjective. They are based on the person's feeling, personal experience, or very well might be the person's opinion. Symptoms cannot be identified by anyone other than the person experiencing the symptom. So the doctor will check, looking, using the instrument that he has, or might be asking you some questions. But questions are supposed to help the doctor to find the symptom that might be associated with the problem that you're having. Now, having had a good grasp of what the signs and symptoms are, then the doctor will be able to make a diagnosis and then, of course, write a prescription if one is needed. What are some signs that you can recall? Of course, we can think about runny nose if one were suffering from influenza. We could also think about a person coughing. These are signs. You can see them, you can detect them. You don't need the individual to tell you that they are suffering from these. Fever. We could use a thermometer to determine if the person is suffering from a fever. And of course, shortness of breath, you can detect. In some cases, the demarcation between signs and symptoms is so close that oftentimes one might say there are some things that can be classified as both signs and symptom. It is still open for discussion. Some other examples of signs would include a pussy discharge, and that is going to be depending on the disease that you're affected by. But sores on the body, lesions on the body, these are, of course, signs in some cases. Stillbirth, diarrhea, vomiting, all these are examples of sign. They are in no way the complete set of signs that a person or persons can suffer from having been affected by a disease. Here we have Tom, and he's suffering from rash. Rashes all over the body. He's obviously suffering from some form of disease. Signs. Throughout COVID, we would have observed or we would have been party to taking the temperature of a person or having our temperature being taken. Here they are detecting sign. And this is of course a sign as to whether you might be suffering from COVID or otherwise. Symptoms, on the other hand, last year many students differed on their CXC exams as they were afraid of failure due to their level of readiness. This year, Mr. Wilson and his experienced team from tcpacademy.teachable.com is here to help you get exam ready. Subscribe for free to tcp-academy.teachable.com. We offer courses in CXC Biology, HSB, English Language, and many others. There are several offerings to each course. Enroll in one today. These could be pain, remember? it needs the patient to tell you about the symptom, or the individual suffering from the symptom must communicate these to another person. Fatigue, constant fatigue, nausea, sore throat, question number one here, chest discomfort, itching, loss of appetite, and this is unexplained loss of appetite over a period of time, weakness, and of course, we all can relate to the pain in our tummy, back, muscle, wherever, head, pain. It's always a symptom. Get help with CSEC Biology SBA Labs and Human and Social Biology SBA Labs at tcp-academy.com. Please be reminded to like, share, and of course,